Okay, good morning, good afternoon, good evening, everyone. Welcome to the 142nd 142 episode of Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community, and to all those who have just discovered us today, welcome po at sana po marami po kayong matutunan. Obviously, very, very excited, not just because of the topic but because of our excellent lineup of speakers for today. It is estimated po that 2.2 billion people around the world suffer from impairment of their vision. Sa Pilipinas lang po, vision, impairment, and blindness, they rank among the major concerns in the country with a prevalence rate of 1.98%, almost 2%. Further estimated that there are over 4 million Filipinos living with undiagnosed eye problems na kailangan pong matugunan. And one of the reasons for blindness among Filipinos is diabetic retinopathy. Ito po ay common po na komplikasyon ng diabetes and sana po kasi po despite the availability of highly effective treatment, ito pa rin po ang most common cause of visual loss and blindness among people with diabetes. So kailangan po na mas mapaigting po natin and retinal evaluation and early detection and screening. These are keys to prevention. One of the success stories here is the United Kingdom's National Diabetic Retinopathy Screening Program na nasa ibang bansa. And hopefully that's something that we could successfully replicate yung pong success rate po nila dito po sa Pilipinas. I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of Philippines, Manila. Always a pleasure to be with all of you during our regular Friday. And I always look forward to Fridays because I get to share hosting duties with our resident po na Public Health Communications expert, also our adjunct research faculty at National Telehealth Center, Dr. Susie Pineda Mercado. Dr. Susie. I think she just got dropped off. So we'll go back in the air kapag nakabalik na po siya. Pero tuloy-tuloy lang po tayo sa ating programa. And something that we'd like to share with all of you is that we are not just here being live na naka-broadcast po sa ating Zoom webinar. We can also be found in other channels, sa Facebook channel, sa YouTube channel po ng TVU PPH. So if you go to www.youtube.com/TVU PPH, you'll be able to find our webinars po, no? And also our live streaming for this webinar. We can also be found dito po sa TVUP Facebook page at sa Stop COVID Deaths Facebook page po natin. Of course, all those who are watching sa Channel 101 ng Signal TV channel po natin. We're still trying to get Dr. Susie back on the air. So as soon as she's back, obviously we'll go back to her. Our main speaker for today is Dr. Maria Florentina Tin Gomez. She serves as the head of the Vitreoretina Division of the PGH Department of Ophthalmology and Visual Sciences. She'll give an overview of diabetic retinopathy, its disease burden in the Philippines, and how it can be prevented. Our reactor naman po will be Dr. Gregory Francis Anthony Hermar, who will present the current strategies and approaches to improving referrals of such cases to ophthalmologists.
Raymond, I'm here.
Yon, yes, Dr. Susie, can we have you open your video? Yes. We can hear you.
Okay. Nako, pasensya po kayo. Can you see me, Raymond?
We don't see your video. If you can click your video na lang, I ask you to start.
I clicked already. Ano ba yun? Ayan. Can you see me?
It's not yet showing up. Anyway, we can let's go ahead. If we can hear you naman, loud and clear. Okay. I think she eventually dropped off. Anyway, so as you have seen in our opening billboard po, we've transitioned to broader discussions on how the pandemic has affected health outcomes beyond COVID-19. So we're not just talking about COVID-19 here, but also those that are beyond COVID-19. So yes, we have maintained the title Stop COVID Deaths, but have expanded our discussions and the scope of what we are covering in each of our webinars po, and hopefully we'll be able to do that. You see Dr. Susie
I'm here
on the
na,
air.
Raymond. Can you see me now?
Yes, that's okay. That's
Okay.
better. Yes.
Ako, hindi na ako gagalaw. Talagang gantong-ganto na. Okay, welcome po everyone. We're so happy to be with you. I'd like to greet everyone who's also watching the playback. I know Raymond greeted all of you na, pero shout out lang, General Emilio Aguinaldo Medical Center in Cavite. Merong nanonood dyan si Salvador. Sabi ko, nag-internship ako dyan. Okay, so our main speaker today is Dr. Maria Florentina Tin Gomez, head of the Vitrio Retina Division of the PGH Department of Ophthalmology and Visual Sciences, who will give an overview of diabetic retinopathy, disease burden in the Philippines, and how it can be prevented. Our reactor is Dr. Gregory Francis Anthony Greg Harmar, will present the current strategies and approaches to improving referrals to such cases to ophthalmologists. For the synthesis and closing, we'll be having Dr. Dion Sakdalan, who is the PGH coordinator for training. So, ang bigat po ng lineup natin, these are the best of the upcoming ophthalmologists, and a very interesting topic because some people think, okay, may diabetes, iinom ng gamot, lumalabo na pala yung mata nila. They don't know it, no? And it's irreversible. So it's very important to catch it early, to prevent, if you can, prevent further damage to the retina, and of course, to have regular checkups and see what can be done. Now, we know that you are always excited to hear about the latest news, both here and abroad. And it's for this reason that we bring you the news update.
Okay, for our very first news update po, no, we are looking at a study where it says that you are less likely to get long COVID after a second infection than a first infection. So ang ibig pong sabihin nito, the risks of long COVID, they are higher after the first infection than a reinfection, yung pangalawa po ninyong infection. Pero yung risk po ay hindi po zero. And the effect of reinfection, at least in this study, in people who already have long COVID, hindi po ganon napag-aralan. But hopefully, there will be future studies about it. And this according to a bulletin from the United Kingdom's Office for National Statistics. 4%, 4% po of adults in the survey reported lingering symptoms at least 4 weeks after their first bout with COVID-19. Kumpara sa 2.4% of people who had a second case of COVID-19. Dr. Susie?
Yes, Raymond. From the New York Times, we have a report that's been published in the JAMA Network, where researchers from both sides of the United States, from Cedars-Sinai Medical Center in California and the Brigham Women's Hospital in Boston, estimated the likelihood of new onset diabetes, high blood pressure, and abnormal cholesterol levels in the first 90 days before and after COVID-19 diagnosis. Excuse me, the average age of the patient was 47.4 years. So what we commonly know is that these are risk factors for COVID. Excuse me. Part yata ng long COVID. Excuse me. But what this is saying is that after you get COVID, the chances of getting diabetes, hypertension, and hyperlipidemia is so much higher. That's our news for today. We'll be back next week with the news update. Oh, we're back, Raymond. I'm sorry.
It's
Please
okay,
take
it's okay.
over. I'm coughing now. Okay. Pero may boses na. Oh, no, may boses ng lolo. Okay, game. Raymond, ikaw muna. Parang ka mga introduction to the person on the street.
Yes, thank you so much, Dr. Susie. For those who are joining us for the very first time, we usually set our discussion into context by having the audience watch this very short video produced week in and week out po, no, that we can thank the TVUP team enough for this one. And it is what we call person on the street video. Ito po, we ask questions to the common folks on the street kung ano po yung alam po nila about the topic. And for this week, we ask them, may kilala po ba kayong may diabetes? paanong nakakaapekto ang diabetes sa iba't ibang bahagi ng katawan? Nakakaapekto po ba ito sa paningin? At paano naapektuhan ng diabetes ang paningin ng tao? Please watch this.
Oo, may kilala akong may diabetes at ito ang lolo ko.
May kakilala akong may diabetes, yung lola ko.
Yung father ko ay diabetic siya and he's been taking his maintenance medicines for diabetes for ilang years na.
Opo.
Nakakaapekto ang diabetes sa katawan sa maraming mga bagay tulad ng pagbaba ng timbang dahil kailangan mo siyang mag-diet para hindi tumaas ang blood sugar.
Marami kasing complications from diabetes. Para naapektuhan yung iba't ibang organs niya.
Ay nakaka-affect siya sa iba't ibang parte ng katawan, like if hindi controlled yung blood sugar mo, like in the case of my father, masyado siyang pumayat and kahit konting sugat, ang tagal-tagal nag-heal.
Sa pagkakaalam ko, bawal masugatan ng mga diabetic na tao. Kasi madali silang ma-infectionan at mabilis kumalat yung infection sa buong katawan nila.
Last 2021, inoperahan for cataract yung papa ko, and when we were still in the process of processing his procedure, isa sa sinabi ng doktor na yung high sugar level ng father ko contributed to the development of his cataract, and after the surgery he was advised nga to control his sugar intake or change his lifestyle para hindi na mabuo ulit or hindi na siya magkaroon ulit ng cataract.
Kaya may mga kaso na pinuputol yung parte ng katawan nila na pinagsimulan ng sugat. Madalas kamay o kaya braso o kaya paa. Pwedeng pinapaputol yon para maiwasan yung pagkalat ng infeksyon.
Isang epekto rin nito ay lumalabo ang kanyang paningin. Medyo tumataas ang kanyang grado at medyo parang maulap ang kanyang mga mata. Kasi dahil may diabetes siya ng mahigit 30 years na.
Base sa mga kakilala ko, apektado rin ng mata kapag sobrang taas ng blood sugar mo. Madalas na sumasakit ang ulo, minsan naman lumalabo ang paningin kapag tumataas ang blood sugar.
Siguro it's really more on lifestyle. Sa pagkakalam ko, yung mga diabetic is usually hereditary.
Pero sa tingin ko, may iba't iba pang epekto o may iba't iba pang pwedeng maramdaman ng isang diabetic na tao kapag tumataas yung kanyang dugo.
It would be better if i-control na din natin yung lifestyle natin or magkaroon tayo ng lifestyle change, especially if we know that we are more vulnerable to have that kind of condition.
You're on mute, Dr.
TVUP,
Susie.
it's always great.
You're okay, you're okay.
Unmute pa rin?
You're okay, you're okay.
Okay. Thank you, Raymond. Thank you so much, TVUP. And to all of those who were interviewed, salamat nga tayo sa ating mga person on the street, Raymond. No? Game na game sila. They, they don't have a lot of time to prepare for these questions, but they're able to give us feedback para maunawaan natin kung ano yung pananaw ng pangkaraniwang tao dun sa topic na pinag-uusapan natin. And indeed, on this one, it's very interesting to see there's actually a high level of understanding of diabetes, but not many of them talked about the effect on the eyes. So we want to focus on that for this talk because it is not, what should I say? People don't know that much about it. And our guests were actually telling us that sometimes the ophthalmologist is the one who diagnoses the diabetes. So the patient doesn't know na may diabetes until tiningnan na ng opta yung mata. So marami tayong matututunan ngayon. But before we go to that, Raymond has some housekeeping. Raymond, go ahead.
A little bit of housekeeping po, no? And this relates to those who have been asking about their certificates. We are working on sending po yung inyong mga backlog certificates. We had a little bit of research and it looks like meron pong something about the code kasi we had to automate this process of sending out the certificates, and hopefully you are able to receive na po kahit paunti-unti lang po yung mga certificates of attendance po ninyo. For webinars, we're checking po the entirety of 2023. For those who are asking, certificates of attendance will be given to those who have watched at least 50% of the webinar duration. So, yun po. If you still have any questions, please feel free to email us at stopcoviddeaths@up.edu.ph. For our webinar for today, we will be having a standard panel discussion format. And after our speakers have presented, we will hear from yung pong sa ating reaction and then followed by a Q&A session. But before we delve into the webinar, here is our cute intro video for our fun quiz segment for today.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Okay, thank you so much, TVUP. May we have on the screen po our questions? Okay, thank you. For those who are joining us outside of the Zoom, you may still be able to participate in our fun quiz if you can open up your browsers, type in slido.com, and enter the code po 6510096. That's 6510096 for you to be able to participate in our fun quiz segment. We have two questions for today. The first of which is as follows. When is the best time to refer patients for diabetic retinopathy evaluation by an ophthalmologist? Is it A, upon diagnosis of diabetes? Is it B, when the patient experiences variable visual acuity? Is it letter C, when the patient experiences constant and worsening vision? Or letter D, when the patient becomes blind? Hintayin pa po natin ba silang maging blind? We like to greet those who are joining us locally. Doon po sa mga taga Western Visayas Medical Center from Iloilo City, from the Integrated Provincial Health Office in Marawi City in Lanao del Sur, in Cagayan Valley Medical Center in Tuguegarao City, Cagayan Valley, in St. Elizabeth Hospital in General Santos City, Socsargen, and Cebu Provincial Hospital in Carcar City in Cebu. May mga magpapabati rin po those who are watching us all the way from Los Baños, from Zamboanga City, those from Deca Homes, Loma de Gato, Marilao, Bulacan. Maraming salamat po. From Marilao, Bataan, from University of Rizal System Health Services, from Maasin City. Maraming salamat po sa inyo and our regulars. We see those who are joining us from international. So maraming salamat din po. There are those who are joining us and just wanted to share that it's the 75th founding anniversary of the UP College of Nursing, and she'll be visiting. Thank you so much. Those from General Emilio Aguinaldo Memorial Hospital in Cavite, maraming salamat din po. Those who are joining us from Amang Rodriguez, from Juan Bataan, from Rizal Medical Center, again from Cavite, from RPHS Annex 1 Antipolo, thank you so much. And those coming in from the Philippine General Hospital. For question number 2, we'd like to start by reading off the question here. How can you prevent irreversible damage from diabetic retinopathy? Is it A, early intervention, B, diabetes control, C, regular checkups, or letter D, all of the above? Meron po tayong mga nanonood from Taipei City, Taiwan, sa Chaonin Hospital po, from Island Hospital in Pulau Penang, Malaysia, from University of Hail in Kingdom of Saudi Arabia, from Algeria. Thank you so much for joining us. And then also from Saigon International College, from the Ho Chi Minh City in Vietnam. So we encourage everyone to participate in our fun quiz as we move on to our webinar proper. Dr. Susie?
Okay, thank you very much, Raymond, for that, and to all our listeners. Salamat na lagi kayong nandito. Kung hindi po sa inyo, wala kami rito. Anyway, our first speaker, and I know you're very excited to get this discussion on the way. Our main speaker is the head of the Vitreoretina Division, PGH Department of Ophthalmology and Visual Sciences. Please give a warm virtual welcome to Dr. Maria Florentina or Tin Gomez. Tin, welcome to the webinar.
Thank you very much for that introduction. I will
Go ahead.
share my screen.
Sige, go ahead, Tin.
Yes po, go ahead.
Okay. Okay, so good afternoon to our viewers. I hope I'll be able to help increase the knowledge of the effects of diabetes in the eye in today's webinar on vision, minsan malabo, minsan malinaw, dahil kaya ito sa diabetes. Okay, so this is an outline of my talk. No, I will give a brief introduction and talk on eye conditions, other eye conditions that diabetics may experience, with emphasis on diabetic retinopathy, because diabetic retinopathy is its most visually disabling complication. So briefly, diabetes mellitus is a metabolic disorder characterized by chronic hyperglycemia resulting from defects in insulin secretion, insulin action, or both. Okay. The effect of diabetes mellitus include long-term damage, dysfunction, and failure of various organ systems like the eyes, the kidney, nerves, heart, and even the brain. Okay. So the effect of diabetes on the eye can be in the form of a simple error of refraction to a more severe retinopathy, which causes vitreous hemorrhage, neovascular glaucoma, or retinal detachment. Take note that diabetic retinopathy causes permanent damage to the eye. However, this is preventable as long as we can catch it early and be able to treat you early. So for error of refraction, one of the most common complaints of diabetics are fluctuation in their vision, causing frequent changes of their eyeglasses. So this is due to the myopic shift, nagiging medyo nearsighted, when your blood sugar is high, no, or a hyperopic shift when your blood glucose is low. Another complaint is constant itchiness of the eyelids, on and off eye redness. There's always flakes in the eyelids, and this is due to changes in the skin and the meibomian gland of the eyelid, which is also seen in diabetics. And management for this is warm compress, lid hygiene. If there's already an infection, we do antibiotic lid scrub, and tear supplements will also help. Okay. Similar to chronic blepharitis or recurrent blepharitis, we can also have recurrent hordeolum o yung tinatawag nating kuliti. No? So this is also because of the changes in the skin and the meibomian gland of our eyelids. And management for this is a warm compress. And if there is already an infection, we do need to take antibiotics either topically or systemically. Another common complaint is the eyes is always sticky or laging makate or mahapde, no? Or there's like sand in the eye, no? So this is from tear film dysfunction, also associated with diabetes, because our tear changes. We have glucose in our tear. There's changes in our conjunctiva squamous cell, the goblet cells, and even the function of our lacrimal gland. So management for this is using tear supplements or eye lubricants, and also avoiding aggravating habits like smoking or prolonged use of gadgets. So in the people in the street video, no, one person said that her father was had the cataract. No, so First of all, cataract is a normal part of aging and will eventually affect us in our later years. No. However, diabetics may develop cataract earlier, and the progression of the cataract may be faster if you are diabetic. So the blurring of vision in cataracts is reversible if it's the only problem in your eye with cataract surgery. And cataracts, when it's removed, it does not go back. Okay, so if blurring happens again after cataract surgery, you have to have the eye checked again because it might be something else. So diabetic retinopathy is one of the microvascular complication of diabetes. So this photo shows the severe stages of diabetic retinopathy, what we call the proliferative stages, wherein an eye doctor has to step in already. In the left side of your screen, we have the early proliferative when there is a lot of hemorrhage. If you see those red dots, the middle part there's already bleeding in the eye, and in the right side of your screen, there's already membrane and some detachment occurring in your eye. So how does diabetes affect the retina? So if you have hyperglycemia, you have vascular changes in your retina. We have damaged the capillary, and diabetics also have changes in their blood. So these two in combination causes retinal ischemia, and normal response of the eye for retinal ischemia is to try to have more vessels. So androgenic factors are secreted into the eye, which forms neovascularization. And these are the ones that causes problems in the eye. In the back of the eye, you have fibrovascular proliferation, vitreous hemorrhage, or tractional retinal detachment. If it goes to the anterior side of the eye, you can have neovascular glaucoma. So what are the risk factors to the development and progression of diabetic retinopathy? So these are all landmark studies. I'll not go into details already, but it's already been established that one of the real risk factors for diabetic incidence and progression is poor glycemic control. Okay. However, this is a modifiable risk factor. So that means something can be done about it. Another risk factor identified is the duration of the diabetes. Okay, so how long you've had the diabetes, whether you're controlled or not. No, this is a non-modifiable risk factor. Okay. Another risk factor identified is presence of comorbidities, especially hypertension and hyperlipidemia. Now, this may be non-modifiable but controllable. No, if you already have it. Okay. Other risk factors identified is the age wherein diabetes was diagnosed. This is related to the duration. If you become pregnant, and also intraocular surgery can also be a risk factor for the development of diabetic retinopathy. So what are the symptoms of diabetic retinopathy? Unfortunately, there is really no symptom until you develop the following complications, which is macular edema or ischemia, vitreous hemorrhage, and retinal detachment. That's why it's very important to have the eye check, even if you have good vision. Yung concept na kasi malinaw pa yung pangin ko, so hindi ko naisip na magpatingin, dapat hindi. That's not good, no? An eye checkup is always good once you know you are diabetic. So, why is it, no? Why is it? Ang ganda ng paningin ko pero nasama na pala yung diabetes ko. Because in this slide, you will see unless the visual axis, I don't know if you can see my pointer, no? Unless this visual axis is affected, your vision will be okay. But if the peripheral retina is affected only, then you will not know that there is something going on in your eye already. Okay, I cannot move my slide. Sorry, hindi ko ma-progress
If
yung
it does
slide
not
ko.
move, Ma'am Tin, can you unshare then reshare na lang? Baka ano.
Okay. Okay. So,
Okay, oh,
can you see now? Okay.
go ahead, go ahead.
So, how do we prevent late diagnosis? And the answer is to have yourself screened. So, the diabetic retinopathy screening guidelines suggest that first consult should be upon within 5 years of diabetes diagnosis for patients with type 1 diabetes or diabetes diagnosed before age 30 and for children with diabetes. Now, if you have type 2 diabetes or DM diagnosed after age 30, your first screening should be at the time that you were diagnosed with diabetes because sometimes it is when it's established na mataas ang blood sugar mo, ano pala, at that point lang napansin pero it happened a few years back. So it's very important to have it checked when you know that you are already diabetic. Okay. And for diabetics who become pregnant, within the first trimester, have your eye checked and then followed up every trimester until 6 months for postpartum. So when you're screened for the first time, your diabetes will be staged. No? So either you have no diabetic retinopathy or you have non-proliferative diabetic retinopathy or proliferative diabetic retinopathy, which is where the ophthalmologist really has to step in. In the severe and very severe stages, this is a gray zone. This is when we balance the control of the diabetes of the patient and their ability to follow up before we start, before we decide to give earlier treatment. So once you're staged, this is the follow-up recommendation. Okay, the follow-up recommendation is based on a study on how likely you will develop the proliferative stage or the high risk for severe vision loss stages. And management will also differ depending on which stage you are in. So for example, you are in the mild NPDR is non-proliferative diabetic retinopathy stage. Since your risk of developing proliferative stage is only 5% and high risk for vision loss is only 15% within 5 years, follow-up schedule can be anywhere from 6 to 12 months. Depending, of course, on your blood sugar control. If you're very controlled for the past few years and you have and you are very diligent with your follow-up with your internist and your medication, once a year will probably be okay. Management is just blood sugar control for the mild and moderate stages. Okay, but if you're already on the severe stage, your chances of developing high-risk complication, high risk, we mean high risk for vision loss, is higher. That's why we have to see you more often. And this is also the stages when we can consider laser already, or if you are already in the proliferative stage, we will advise prompt laser treatment, or in certain cases, surgery is already warranted. So what constitutes an eye exam? Okay, so when you go to a doctor, they'll check your vision, check the ocular agnexa, titignan yung eyelids nyo, kung, basic check of the muscle, check your pupil, and they will check via slit lamp biomicroscope for any cataract or other problems anteriorly, tonometry to check your eye pressure, and then they do a retinal evaluation. Okay, so these are what to expect, no? So you can either be subjected to an indirect ophthalmoscopy or have your retina checked via slit lamp biomicroscope with a fundus lens. Now, these two procedures would need dilation of the pupil, so you would have a temporary decrease in your vision because of pupillary dilation. Okay, In some cases, you will be asked to have a wide field fundus photography. And depending on what the machine, the hospital or the center have, it can be either mydriatic, meaning you need dilation of your pupil also, or non-mydriatic. And the goal is to be able to check the retina. Okay. So sometimes you will be asked to have ancillary tests, no? So we have fluorescein angiography of the eye. This is when they inject via intravenously fluorescein dye to check for leakages, areas of edema, yung namamaga or namamanas na mata, leakages or areas of capillary dropout. Okay, so this is a little bit invasive because they do need to inject a dye in your bloodstream. Other less invasive ways of checking the retina, currently we have OCT angiography. Okay, OCT angiography, you can see areas of ischemia through the Doppler mechanism or of examining blood flow. So if there's blood flow in the area, the machine will detect it. If there is no blood flow in the area, the machine will interpret it as an ischemic area. Okay, so we also have macular optical coherence tomography, usually to just evaluate the macular area, the center of the eye. This is when we are suspecting diabetic macular edema. So in some cases, we cannot see the retina. So before we advise the patient, we would ask for an ocular ultrasound so that if we can confirm why we cannot see the retina, if there is hemorrhage there, if there is already a retinal detachment also. Okay, so management options. Okay, so if your doctor will determine your stage and then advise what management is needed. So here we have on the left side of the screen is laser treatment of the eye, or what we call panretinal photocoagulation. The middle part of the screen is what your retina will look like after the laser is done. This is used to destroy ischemic retina to reduce the VEGF formation or the angiogenic materials that are secreted by this ischemic retina, and also to direct blood flow and oxygen to the more viable retinal tissue. Okay, sometimes you will be advised to have an injection of a medication in your eye, or we call intravitreal injections of anti-VEGFs. This medication binds VEGF, which may control neovascularization. And it's also the mainstay or the standard of treatment for center-involved macular edema. Okay, so in late stages, you might need a retinal surgery already. So this is just a schematic picture of what happens inside the eye. You know, we have to go in, remove whatever is obstructing the view of the retina, remove blood, remove the membranes, so that the retina can be reattached and can be able to apply laser treatment to the ischemic areas as well. So here I'll give you some sample cases of some patients we've seen. Okay, so here we have a 45-year-old male, 5 years irregular control of diabetes. He actually only consulted because it was a requirement for pre-employment, and his vision was 20/20. So normally he would not have consulted, but if you look at the fundus photo and look at it on close-up on the right upper screen, this close version, there is already a new vessel forming in the eye, as confirmed by the angiogram. So he would need laser treatment to be able to maintain that 20/20 vision so that the retinopathy will be controlled. Okay, another case, we have a 57-year-old female. She's been diabetes for the past 10 years, but no consult done until there was a sudden drop of her vision a few weeks before consult. So vision on the right was still 20/70. So hindi pa totally off, no? O, medyo mas malabo lang compared to her left eye, which is 20/40. And if you see on the left side of your screen, there is already bleeding that's going on in the eye. On the right side, there is small dot hemorrhages and also the yellow spot in the middle that you see that is exudates signaling macular edema. So she would need laser also if that doesn't work. surgery might be needed. For the left eye, injections and laser would suffice. So this is a sad case because patient came in very late. The left eye was her right eye, which is the left side of your screen, only had light perception, and unfortunately, I couldn't help her with that anymore. On the right side of your screen, which is actually her left eye, it was very advanced. Those white things is what we call fibrobascular proliferation. The gray area, I don't know if you can see my pointer, is the detached area already of the retina. So patient had to have a retinal surgery. So, well, unfortunately, I couldn't give 20/20 vision to this patient. Vision was only, I think, 2400. Well, at least some vision was saved. This is another sad case. She was already advised to have laser beforehand. He pala, sorry, but diabetes was not controlled. He was also not following up with the internist. And same patient 1.5 years later, left eye already had glaucoma, and the right eye was also had detachment, and patient wanted 20/20 vision, but unfortunately you cannot give it back to him. So actually this patient was lost to follow up. But we have nice cases also, nice results naman, no? As long as you got treated early. So this patient is actually a doctor, no? She was diagnosed with a diabetes at age 40. Her friend said, have your eyes checked, pero kasi daw maganda pa, kaya hindi pa siya nagpapacheck. But suddenly, her left eye, okay, this is a picture of the right eye. Left eye suddenly had blurring of vision. So when I checked her eye, this was in 2017, despite having good vision on the right eye, there was already a blood vessel here, blood vessel forming on her overhead nerve. We did laser treatment, and until 2021, this is our last picture, vision remained 20/20, and the neovascularization is controlled. Her left eye, the one she complained about, had already blurring of vision because it was already had bleeding, no? So I gave her an option. I ko, try natin muna to laser and then see. If it doesn't work, then I will operate. And fortunately enough, laser worked. So it stopped the progression of the retinopathy. The hemorrhage eventually reabsorbed. And on her last photo, there's just residual membranes, but her vision is still 20/20. Okay. The last case is this one had surgery. I don't have a preoperative picture because there was really no view. Unfortunately, her right eye was already beyond saving, so I was able to do surgery only on the left eye. And 1 year after surgery, this is what it looked like, the one in your left side of the screen. Her latest follow-up, it's still stable, no, and vision is still good. So, take-home message. Diabetes can affect the eye. Diabetes can cause permanent loss of vision. And the loss of vision from diabetes is preventable. Okay, so how? So once you're diagnosed with diabetes, please don't be in denial. Okay, change your diet and your lifestyle. Be compliant with your medication. Okay, have your eyes examined even if your vision is still good. Do not wait for your vision to deteriorate before seeking consult. And when told you need an intervention for your eye, then I hope you do comply. No, if you do not believe, you're not convinced by one doctor, you can always seek a second opinion. And if the two doctors say this is what you need, and then maybe that is really what you need, and so go forward with it. Another point we have to take into consideration is even after treatment of your eye, you still need to maintain a stable blood glucose level. So you have to continue following up with your primary doctor. And lastly, there is no eye drops that can treat diabetic retinopathy. So there's a lot of things being marketed online. So those are not real treatment. So thank you for your time, and I hope I was able to add to the knowledge on diabetes and the eye.
Thank you so much, Tin. Nako, ang ganda. I love the visuals, and it was a good review. No, highly specialized field, but also the cases were kind of scary. No, when you hear about relatively younger patients that have very very serious eye illness, and it's because they didn't know. And right now, our audience are mainly mga frontliners and clinicians and nurses. So this is really a very good reminder. Thank you so much, Tian. That was an excellent presentation. So let me turn over to Raymond for our next speaker.
Thank you. Thank you, Dr. Tin. We look forward to you answering the questions po mamaya po sa Q&A, ma'am. Dr. Susie, our next speaker is also from the Department of Ophthalmology Visual Sciences, also a vitreoretinal surgeon po. Please welcome, first time po sa ating webinar, Dr. Gregory Francis Anthony Hermar, si Sir Greg. Sir Greg, go ahead, sir.
Hi, good afternoon. Good afternoon to the audience. Yeah, let me just share my slides. Hi. I cannot share while the other participant is sharing.
Oh, okay.
Ayan.
Yan, okay, sir.
So yeah, okay na yan, Greg. There, very nice. Very nice.
Okay. All right, let me. Okay, so yeah, my talk right now is about the increasing burden of diabetic retinopathy. So the global prevalence of diabetes is substantial and rising. No? Between 1980 and 2015, the prevalence of diabetes has doubled worldwide. 415 million adults were reported to have diabetes in 2015. This is predicted to rise another 55% to 642 million by 2040. Okay, so it's a global emergency. So if you look, worldwide is going up. We expect it to increase worldwide 48%. However, this is even worse in our area, Southeast Asia. In 2017, we have 82 million people with diabetes. That's expected to increase 84% by the year 2045 to 151 million. So the burden is really increasing. Again, the worldwide prevalence rate of diabetic retinopathy of type 2 diabetes is 25.1%. In the Asian region, it's about that also 23%, with most of it 19.1% non-proliferative diabetic retinopathy and 2.8% proliferative diabetic retinopathy. This is actually a little worse or much worse in Southeast Asia. For example, in Hong Kong, it's 39% in some studies. Thailand, 24 to 31.4%. Malaysia, 39.8%. Singapore, about 30 to 35%. Indonesia is the highest at 43.1%. And we have somewhere in the middle, not 28.2%, but that's still a lot. There is a need for updated, accurate, and comprehensive data for our country. No, in a recent review article, we were actually cited as having not very good estimates, no, not available from among these countries. No, we do have some data. No, in the 2014 prevalence estimate published by the International Diabetes Federation, there are about 3.2 million cases of type 2 diabetes in the Philippines, with a 5.9 prevalence rate in adults. Among newly diagnosed patients, 2% were found to have diabetic retinopathy on consultation. However, the patients that we see at the Philippine General Hospital show a much different picture. No, we did studies on diabetic patients in our hospital, and the prevalence of diabetic retinopathy was found to be 61.8% clinically and 83.6% on angiography. This was a study by Dr. Gomez. The Philippine National Survey of Blindness and Eye Disease study in 2018 showed that diabetic retinopathy was seen in only 0.59% or 600.6 million of those patients screened. So that seems low, no? However, smaller telemedicine screening studies are more in line with it, no? Diabetic retinopathy was seen in 25% with the same distribution of non-proliferative and proliferative. Another study showed about the same, 28.2% of patients, a diabetic patient was found to have some form of diabetic retinopathy. Okay, so how would we tackle this problem? Not Dr. Gomez already tackled the treatment, but we have to approach it, from prevention standpoint, no? So these are our strategies that we usually encourage, no? Primary prevention, we improve awareness both in patients and in healthcare providers, no? Lifestyle changes, medications to control the risk factors, and a systematic screening program for early detection of diabetic retinopathy. Then we go to secondary prevention. These patients are the ones who are already diagnosed as having diabetic retinopathy. We treat their diabetes to control the risk factors for progression, regular screening to monitor, and we should have a clear-cut guideline for treatment for diabetic retinopathy. Tertiary, Dr. Gomez has already gone through the treatment of that, no? So we go to primary prevention. Who are the sectors responsible for this? This is the public health sector, primary healthcare sector, and other sectors such as media and those influencers, no? The objective is to prevent or delay the onset of diabetic retinopathy in the at-risk population. Challenges are there's poor awareness of diabetic retinopathy among patients. Awareness of diabetic retinopathy is not optimal among primary care physicians and other healthcare workers. So parang it's at the back of our minds, no? So they'll treat the diabetes, but sometimes they neglect to ask the patients about how is your eye, or advise them to have a checkup because the patient will say their eye is still okay. So solutions are to make educational materials more accessible through various media forms and structured education program for healthcare workers. Diabetes Awareness Month is spearheaded by the Philippines Center for Diabetes Education Foundation. It involves medical missions, health forums, screenings for glucose, food assessments, fat analysis, and occasionally eye checkups. No, these are other organizations that are coordinating that are dealing with diabetes, especially in Diabetes Awareness Month. No. Mulat Mata was a project of the Vitreoretinal Society of the Philippines to celebrate. That was a few years ago. No, what was that? A year or something. No. Anyway, we launched this program for diabetes awareness. It involves the goals were to increase awareness about diabetic retinopathy and its complications in order to improve health-seeking behavior in the community. Okay, so what did we do? We had identified certain areas that we did a pilot project on, usually in Region 1, I believe. So we distributed many brochures for patient education. We did digital campaigns on various websites and social media. We did radio campaigns, TV campaigns, and our doctors also went around doing mini lectures. Okay. So this was also we also tried to recruit, Facebook partners such as these influencers in trying to get the word out to patients about diabetic retinopathy. So, screening, the challenges are limited access to diabetic retinopathy screening, a limited workforce to screen, and sustainability of these screening programs. So we don't want to just, have a parang screening mission here and there. You'd like to have a systemic national program and sustain. No? So solutions, telemedicine-based screening is making it easier to reach more far-flung areas and to get the pictures and the screening done elsewhere by specialists. No, the newer things are the use of AI tools to enhance the screening and decrease the workload. Engagement of both government and non-governmental organizations should be done to implement screening and referral programs. So the DOH also has screening programs. No, for example, the Ilocos region has a mobile eye clinic. They are targeting geographically isolated and disadvantaged areas. Again, the Mulat Mata project of the Vitreoretinal Society of the Philippines is trying to slowly develop a feasible and effective diabetic retinopathy screening program at the community level. So we have a pilot area, and it's still ongoing. And eventually, we hope it bears fruit and becomes a national screening program. No, so right now it's in Region 1. So they have mobile diabetic retinopathy screening done there. No, portable devices. Everything's getting smaller now. We don't need cameras. Our phone is already a camera. There are attachments that you can attach to your phone that you can take a good fundus photo that expands our reach. We don't have patients don't have to come to us for the equipment. We can bring it to them. So that helps. And also telemedicine and artificial intelligence again. Artificial intelligence is actually almost ready. We feed the database to a computer, and it learns to diagnose the diabetic retinopathy from pictures. So the accuracy is almost like 98% already at the moment. There are several models for this, but that's a different lecture. So there are several studies ongoing right now in the Philippines. For example, this study with the UK, and actually we are trying to get some a study off the ground here in PGH, for getting our own AI algorithm to screen fundus photos for diabetic retinopathy and other diseases. So secondary prevention, these are patients who already have diabetic retinopathy. So strategies are the main thing that we're trying to get is again screening and more awareness of it. So a few years ago, the Vitreoretinal Society had a memorandum of agreement with the Philippine Society of Endocrinology and Diabetes and Metabolism. We encourage closer collaboration between these two societies to address diabetic retinopathy, specifically, increase the level of knowledge. We improve the referral rates, and to make sure that the endocrinologists also integrate eye health with the diabetic management. Okay, another thing we did to help the VRSP is to publish the preferred practice patterns. So we define screening and treatment, treatment patterns. So everyone knows when to refer, when to screen, and how to treat. Again, the Mulat Mata Foundation also tries to identify. We try to create a map out where are the ophthalmologists, where are the treatment facilities, where can you be screened, and they try to forge stronger relationships with the local government units and have partner hospitals. Okay, so what is the urgency? Why are we, moving, so hard to get the patients to come in earlier? Diabetes is a leading cause of vision loss among working age adults. So, and from these patients, loss of sight is a complication that concerns them the most, Okay lang mawalan sila ng paa, pero when they lose their vision, that's really distressing to the patient. Not that losing a foot is not distressing, but yeah. So 5 letters is the division is of vision loss. Why do we fight so hard to keep it? How significant is that to a patient? Is it worth the trouble of cost of treatment? I lose 5 lines in the chart. Yes, it's important. 5 letter gains give clinically meaningful results for patients with vision impairment from diabetic macular edema. So a 5 letter gain translates to you being able to read the newspaper or reading the small print instead of just the headline, or being able to drive. So when you improve the visual acuity, you can actually make a difference in the daily lives of your patients. So yeah, that ends my response. Perhaps together we can all work to decrease the burden of diabetic retinopathy.
Thank you so much, Greg. Thank you for that excellent presentation. And I think a way forward for us to think about the whole system and how we can support each other in preventing blindness among those who have diabetes. Okay, so maraming salamat. We are looking forward to having you both on our panel discussion where we'll take up some questions from the audience. But before that, Raymond has announcement. Raymond, go ahead.
Yes, just a little bit of a break lang po for everyone as we ready the questions for our Q&A. We will have this very, very short pong break for our special public service announcement today.
O sige na anak, parang kagat lang ng langgam. Kantik o yung kumikiliti lang? Ito naman parang hindi ka pa nababakunahan dati. Akala ko pa naman brave girl ka. Nakakahiya na kay Doc.
Okay lang po, nanay. Ay, ang cute naman ng shirt mo. Favorite color ko rin yan.
Doc, favorite ka rin po ang color nito. Pero ayoko po ng red huntik. Masakit kumagat at takot rin po ako sa blood. Magtutugo po ba ako sa bakuna?
Ah, hindi. Walang dugo sa bakuna. Konting pisil lang, tapos na.
Kakasugat ba ako, Doc?
Hindi ka magkakasugat. Lalagyan lang natin ng plaster pagkatapos para safe. Di ba nabakunahan ka na rin ng contra measles at chickenpox dati? Parang ganun lang din ang bakuna para sa COVID-19.
Natatakot pa rin ako, Doc.
Alam mo ang secret sa pagiging brave. Hindi ibig sabihin na wala kang kinatatakutan. Kundi, kahit natatakot ka, hinaharap mo pa rin ito.
Okay. Ready na po ako, Doc.
Una, pupunasan ko muna ng bulak na may alkohol ang braso mo. Okay? Tapos, mabilis lang na konting... Ayos! Tapos!
Tapos na, anak. Pwede mo nang buksan ang mga mata mo.
Nay, sabi sa inyo, brave girl na po ako eh.
O, heto ang prize para sa'yo, ha? Wow! Bagay sa shirt mo. That's the color of bravery.
Color rin yan for love.
Thank you, Doc. Thank you, Nay.
Dahil ako po ay mahal ninyo, nagpabakuna na ako.
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP. The COVID Communications Public Service Announcement is just one of the many outputs, creative outputs of Stop COVID. That's team to push for pediatric vaccination for children age 5 and above. Please share this video clip to all of your social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. Okay, let's start the ball rolling with our first question, Dr. Susie.
Okay, so do we have our, I can't see kasi, do we have all our videos open now for Greg? There we go. Okay.
It is. Yeah.
We've got Greg and Tin, and we have some questions from the audience. But to start the discussion, I wanted to ask about, kasi Tin, one of your examples was a health worker or a doctor, right? So I wanted to ask about doctors who have diabetes, doctors or nurses who have diabetes, and how do we encourage them to have their eyes checked? Because you talked about don't be in denial, diba? But we know our frontline workers, you know, even if they're hypertensive, they've got diabetes, they have hyperlipidemia, eh talagang sige lang sila ng sige, no? So maybe you can address a bit the issue in relation to our doctors, nurses, and other health workers who might have diabetes. Sige, Tin, ikaw muna.
I think it's the mentality. Okay. Parang sanay tayo to wait until the last minute, and if you don't feel anything, everything is okay. So, yun nga, that's a problem with diabetic retinopathy, or you don't notice it unless it's already in the center of the eye. No, and sometimes at that point, sometimes we can help you, but sometimes we can't help you anymore. So, I guess awareness talaga that diabetes can affect the eye, and symptoms may be none, no blurring of vision, no, or very minimal. For healthcare workers, it will be easier for them nga to have their eyes checked. No, they're already in the hospital, but maybe time, they're probably busy also. So I guess it's just a change of mentality and more education, awareness.
Tin, before I go to Greg, Tin, when we say nanlalabo yung mata, okay, so again, our audience are mainly health workers, no? Of course, we do have people from DepEd, from the general public, etc. What does that what is the experience like? Ano yung nangyayari sa kanila when we say nanlalabo? They can't read, ganun ba? Or what is it that they experience?
Actually, it's different eh. So some of the patients na I come across with, no, they will describe their blurring of vision as they're able to use their cell phone. Later on, parang lumalabo, they rest a bit, they blink, okay na. So sometimes that's just the tear film, nag-dry lang yung mata. Kaya when you blink, it becomes okay, no? But if it lasts for a day and then on and off, no, it can be already a signal that there is too much sugar in your body that is already affecting your lens, no? So lens pa lang, hindi pa nga retina yun eh. Sa retina kasi, ayun nga, unless it reaches the macula, medyo mahirap matrack, no? Kasi until they see blood, no, yung sinasabi nilang yung iba will say floaters, maraming itim daw na lumulutang-lutang. No, then it may be actually normal. There are normal floaters in the eye, but it can also signal that there's bleeding happening in the eye already. So iba-iba kasi yung interpretation of what is malabo ang mata is. It can be a simple nag-haze lang to cannot read or cannot see.
Yeah. Oo, kasi pag sinabing malabo yung mata, what does it really mean, no? Thanks for that, Tin. Greg, ikaw naman. Anong view mo dyan in terms of our frontline health workers and who have diabetes? How do we get them to have that screening and that checkup?
Well, how? Well, basically, it's awareness, no? I mean, they should, kasi the attitude, well, doctors and healthcare workers make the worst patients, diba? So the attitude is usually, if wala naman ako nararamdaman, okay lang yan. And in a sense, sometimes, and I'm guilty of this also, parang gusto ko ba malaman? Do I really want to know na may problema
Yeah, we're
ako?
all like that, no? We're
Diba?
thinking the worst thing, kaya wag na lang kasi malalaman pa natin.
Correct. So
Uh-uh.
yun, it's a matter of awareness. Sometimes you just need to be reminded na, hey, your diabetes is not just your sugar, it's not just your kidney, it can also affect your eye. And a corollary to that actually is, if we have an eye checkup, we can actually pick up other things, because the eye is the only place that you can actually visualize the microvasculature of the body, diba?
Right.
So if you see something wrong with your blood vessels in the eye, those are the same sized vessels as in your kidney, diba? So
yeah, thank you, Greg.
another
Tin,
way.
I'm going to go back to you with another question before we take the questions from the audience. No, you gave us 2 cases, 3. How many cases did you give us? 4 yata, no? Give us a number of cases, and one of the things that you mentioned is that you could have this in younger patients. Can you talk a little bit more about that?
Diabetic retinopathy can happen in any age group, no? Basta may diabetes. Actually, the younger individuals with diabetic retinopathy, we notice mas mabilis mag-progress. Okay? Yeah, because we have a structure in the eye, we call it the vitreous, yung gel ng mata. It what gives bulk to the eye. Sa mas bata kasi, that is still in contact with the retina. So when diabetes retinopathy develops, parang it becomes a source of a scaffold, no? Yung vitreous, kakapit yung vessel. And then as we age, that vitreous actually lifts eh. So nahihila niya, and then it causes more problem. So in younger patients, we are a little bit more aggressive. Another thing also is these are people who still has the capacity to work. You don't want, early on in life, hindi na sila makatrabaho. And not just them, they're caregivers. Somebody has to take care of them. And, lifespan is mas mahaba pa. So, mas importante, or not, hindi naman importante sa matanda, no? Pero yung bata, these are economically productive people. No? So, sayang. Yeah.
Right. Okay. Thanks a lot, Tin. Okay, Raymond, I think we've got a couple of questions in the Q&A box, and I've got something actually on my phone.
Okay.
So go ahead, Raymond.
One of those questions, I think, is one of the slides of Dr. Tin. So I'll just leave it for later na lang. I'll just select the first one. But it's more, I think it's more of getting the opinion of the ophthalmologists about it. So in many occasions, TV personalities, more often than not, they interview optometrists and call them doctors. So sino daw po talaga ang in the best position to diagnose these problems? So I'll leave it to the both of you, Sir Greg and Ma'am Tin.
Okay, sige. Okay. Optometrists train to check error of refraction. So if your problem is just eyeglasses, error of refraction, nearsighted ka, farsighted ka, kung yun lang yung problema mo, they are well equipped to get your refraction and prescribe eyeglasses. Pero kung may sakit na yung mata, no, you have cataract, you have diabetic retinopathy, the doctor will be the one to be able to diagnose and treat them. Actually, our optometry friends, they actually sometimes are the one that picks up that there's something wrong. Patient keeps going to them, papapalit ng salamin, tapos sasabihin nila, hindi namin makorek, paulit-ulit na tong grado, change yung salamin mo. They will even encourage the patients to seek an eye doctor. So there's no problem naman, no, it's just what disease is being addressed, no, kung error of refraction lang or sa loob na.
Yeah, so parang it's a team, it's kind of like a team effort also, kasi it can also be picked up by general practitioner, di ba? Hindi naman, and so I think the question is about the referral actually. When should the referral be done? Anyway, go ahead, Raymond. Meron ka pang question. I have a
So the
question.
other one,
If I might add,
is about po.
Yeah, Greg, go ahead, Greg.
Go ahead,
No,
Sir
no.
Greg. Sige.
Oh,
no, that was a good point because they also expand the reach of for screening purposes. Because a lot of people consult talaga for glasses, and that's one of the best places to pick up eye problems. So that's it.
yeah. Oh, so okay lang, anybody, whoever has suspicion that this might be diabetic retinopathy and not just an error of refraction should be able to make that referral. Di ba? Parang ganun na, yun yung one of our messages. So it's not about which professional, because anyone can have that idea na, oops, baka may diabetic retinopathy. Di ba parang ganun yung gusto nating sabihin?
Yes.
Okay, Raymond, go ahead. Your next question. I have one
Next
here.
question is about eye drops, pero I saw it in the last bullet of Ma'am Tin. Maybe she just needs to emphasize that. So the question here is, any ophthalmic drops that really improve vision with no need for surgical intervention, and are they FDA approved? Ma'am Tin, go ahead.
Okay, so depends on the condition. If you have dry eye drops, tears, lubricants will help. Okay. If you have glaucoma, there are glaucoma medications that help control eye pressure to prevent damage of glaucoma. But if your problem is already all the way to the back of your eye, involving your blood vessel, your eye drops will not reach that area anymore. So marami kasi din talaga, we see it miracle drops being marketed, and there's no way it's going to reach all the way to the back of the eye to control diabetic retinopathy or even fix it. Even cataracts, there are eye drops that would slow down the cataract, but they do not treat the cataract. Okay, so surgery pa rin yung sa cataract if it's already visually disabling. Okay.
Sige. Tin, I have a question here that's not related to diabetic retinopathy, but I think it's a good question to ask. So the question here kasi is, how does screen time affect eyesight? So if you're spending a lot of time in front of a computer or looking at your gadgets, how does that affect your vision? And so my follow-up question to that would be, what kasi ako I experienced that sometimes after matagal na ako nasa computer, I need to rest, right? So, how long, or what's the interval for rest or or how, yeah, I don't know. What do you advise on this?
Okay, so I guess advice will be different depending on the age group. If the eye is still a developing eye, children, we really discourage long use of the computer or any device that they have to focus very near, no? Because developing pa yung eye, no? Kaya sinasabi nila tumataas yung grado, nagkakaroon ng change in the lens, no? The focusing power of the lens of the eye. There are also actually some studies that's going on that exposure to UV of children also prevents progression of myopia or yung pagiging nearsighted. That's why encouraged na dapat during break time ng mga bata, they're outdoors, hindi nakaupo lang sa loob ng classroom, no?
Okay,
Ngayon sa adult naman, the computer is not the problem. It's how we use it. If you are on a computer for a long time, hindi lang computer, even reading books, your eyes are open longer, no? So you blink less. So if you blink less, there is less production of fluid or the tear film, and also hindi na spread well yung tear film. Plus, nakadilat ka, mag-evaporate din yung fluid part of your tear film. So it's the length of use of the gadget. So ideally kasi we blink every few minutes. Normally, if you're not looking at something, you'll notice we blink more. But if you're staring and concentrating on something, nakaganon ka. So hindi lang actually nagko-computer yung mga nananahi, no? Yung mga accountant na books, no? They look at the paper, no? Books. So it's the how long you keep your eye open. So the is try to blink as often as you can, no? Kung talagang hindi mahahabol and it's really dry, you put eye drops, no? Another thing that can aggravate it is the environment, no? Pag mainit, no? Or you are in an air-conditioned room. Air-conditioned air is dry air, no? So that will also aggravate dry eye. Smoking, usok, no? Irritant sa eye. There are other conditions also that will aggravate the situation.
Thank you. Greg, did you want to say something? Go ahead.
Just to add to that, no. It's surprising to most patients when I tell them that when you're concentrating on a gadget, watching TV or sewing or whatever, you blink only 30% of your normal rate. So
oh wow, okay,
that's big, diba? So so the Philippine Academy of Ophthalmology actually what we normally say we promote is the 20-20-20 rule, no? Every 20 minutes of doing something, close your eyes for 20 seconds and then look at something distant, maybe 20 feet away. So that both re-wets the tear film and resets your focusing, no? Kasi sometimes nakatutok ka, then you get, eye strain, myopia.
I like that.
You look at something distant, look out the window.
Oo, madaling matandaan. Yeah. Yeah, that's very good. Very, very good advice. Raymond, do you have a question there? Kasi I also have one here. Go ahead. Ikaw muna, Raymond.
Well, it's from our regular, Dr. Joseph Tortona. And I'll just read it off here. That's in the chat box. It reads, my mother was never referred by her optometrist to ophthalmologist until she complained of very painful right eyeball. Examined her and found her right eye as hard as a golf ball. Immediately advised her to go. And this happened when he was a fourth year UERM student. And the mother was taken to Makati Medical Center. At that point, meron na daw po siyang acute angle closure glaucoma. She has been having right-sided headaches and keeps on seeking consult with Sarabia Optical Clinics, but given pain reliever. So, is that something po ba na to your point earlier, the constant coming back to the optometrist, is that already a red flag for them to seek consult, Ma'am Tin?
Yeah, I think so kasi kung hindi nasosolve yung problem by an eyeglass or I think what was given, pain reliever, it keeps coming back. You already parang have an index of suspicion that there is something else going on. Okay. So I can't comment on ano yung findings nung sa Sarabia, but sometimes din kasi it's not just hindi nasabi or hindi naintindihan, may miscommunication. So I don't know what happened there, no. But yun nga, kung hindi na-solve initially, then there's probably something else that's going on, Dai.
Okay, I have another question here, which is, do patients with borderline blood sugar or pre-diabetes or metabolic syndrome also have risk for diabetic retinopathy? Kasi maraming, I'm trying to understand the question. Parang there are quite a number of people who are not diabetic and taking medicine, but their blood glucose is probably fluctuating or they're on the margin. Should they be screened? I guess that's the question.
I think dapat i-clarify muna kasi kung diabetic or not eh. Kasi parang feeling ko, if you are well, the way I understood it, if you are pre-diabetic, you don't really need medication. Diet, they try diet and then see if everything will be okay. But if you need medication to control your blood sugar, I think that is already a definition for diabetes. So that means you already have it, and then you should have your eyes checked already.
Okay. Yeah, that's clear.
A yearly checkup is okay for everyone.
Yeah, you don't lose anything from it, no? Parang ano yun eh, parang going to the dentist also, right? You have nothing to lose. Sige, Raymond, meron ka pa dyan?
No more questions, Dr. Susie. We can go to our fun quiz.
Okay, go ahead.
Okay, can we have it on the screen? Both the Slido po and in the Zoom poll. Okay, for our first question, so I'll read the question and then I will call upon the ophthalmologist who will answer po. For the first question, we'll go to Dr. Gomez. First question, when is the best time to refer patients for diabetic retinopathy evaluation by an ophthalmologist? Okay.
So yeah, 75% of the respondents naman were able to get it, no. So ideally, upon diagnosis of the diabetes, to be sure.
Okay. Thank you, Dr. Tin. And then for our second question, this is for Sir Greg. How can you prevent irreversible damage from diabetic retinopathy?
Okay, so yes, very good testmanship. When you see all of the above, it's most probably correct.
Thank you, sir. So, early intervention, diabetes control, regular checkup. So, sir, I think one of the questions that we got naman po was about is it really preventable? Parang is it something na pagka nagka-diabetes ka ba, are you sure to eventually have it? Or with all of these three things, you lessen the chances na hindi ka umabot doon? That was one of the questions that we got.
Actually, studies have shown that, after 5 years from diagnosis of diabetes, 80% of patients will have some form of diabetic retinopathy. But if you control it well, it may just be a small hemorrhage, something that's not clinically significant or you need treatment. But yeah, eventually all diabetics will get some form of diabetic retinopathy. It's a matter of controlling it to a level that it's not clinically significant.
Wow, okay. Raymond, may pahabol na question dito. Although, yeah, you go ahead and read it. It's in the chat. And
okay, question from the
chat. Borderline question eh. Sige, go ahead.
Yeah. Her father was complaining na lumalabo ang mata, consulted with an ophtha, sabi daw po, nag-start na yung cataract ng patient. Given lutein and 2 eye drops and solidexide, blood chemistry and was done and borderline po na mataas yung blood sugar niya. Nothing given for the borderline na mataas na blood sugar and cholesterol was high. The question was what to do. Is it better to have it checked by the IM for it to be managed?
Tin, ikaw to.
Okay. So, Okay, first of all, father niya, so I would assume medyo may edad. So so pwede talagang may cataract, no? And binigyan ng eye drops. I don't know what the eye drops was given, so maybe it was there are eye drops I said that can slow down, no, the progression of the cataract. Maybe the other one is for dry eye, no. I don't know what the drops were, no. Soludexide is like a mild blood thinner, no. So I think may sinususpect na meron medical condition nga, no, with the blood chem, no. But seeing na meron mataas na sugar and cholesterol, I think it's better to have an internist have an opinion on it. So that proper management and other workup, kasi baka may iba pang problem sa dugo, no? Baka hypertensive din, hindi lang diabetic, no?
Okay.
There's one more question here. Naku, mahabol mga question natin, Raymond.
Patient has retinopathy, had PRP already and given ketorolac. Is ketorolac okay for long-term use? I'm not sure, medyo vague yung pero that was the question if you're seeing it on the chat, Ma'am Tin.
Okay, so PRP is the retinal laser treatment for the eye. Sometimes we give ketorolac is a non-steroidal anti-inflammatory eye drops. No, it's given after laser treatment because sometimes after laser treatment we experience some sort of inflammation inside the eye. So it's used to control that. You don't need to use it long term if it's for post-laser medication. No, it's not also used to use it very long because long-term use of non-steroidal anti-inflammatory drops can cause thinning of the cornea. Ibang parte yung mata pwedeng maapektuhan. So hindi siya pwedeng matagalan. Usually that's just given for a few weeks to at the most maybe a month.
Okay, so si Marie who was asking early is thanking you, Dr. Gomez, for your question. Unfortunately, we don't have a lot of time. We'll have to go now to our final remarks from our speakers. But before we do that, we'll give our speakers a few minutes to think about what they want to say as their parting message. But we will have our evaluation now, Raymond. Go ahead.
Thank you so much. Can we have it on the screen, our evaluation? There we go. Okay, so we are not sending out separate evaluation polls. Ito na lang po iyon. It's a 5 question evaluation poll and we hope everyone will be able to participate here. So just as I read this, hopefully our speakers will take the time to come up with their final messages, takeaway messages to our audience. The first question, panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge in managing various key health issues. We will not be closing our panel discussion poll until the end of the webinar as we move on to the final messages from our speakers. Dr. Susie.
Okay, thank you so much, Raymond. And we're going to keep that open for your response. Okay, so we'll start with Greg. Greg, what's your parting message for our audience?
Stay safe. Well, I guess for parting message, you know, if you're diagnosed with diabetes, you know, have a checkup. You know, you have nothing to lose and everything to maintain. No? Okay. And stay safe.
Oh, thank you so much. That's Dr. Greg Hermar from the Philippine General Hospital. Let's go to Tina. Tina, your turn.
So maybe my parting word is diabetes can affect the eye, no, and you may have no symptoms at all, so you have nothing to lose if you have your eyes checked, no, and diabetic retinopathy can really cause blindness, which is irreversible but preventable. So have your eyes checked, no, so that we can, you know, have a better quality of life.
Thank you so much. I said Tina. Tin. That's Dr. Tin Gomez, also from the Philippine General Hospital. All right. So before we call on our speaker for our closing remarks and synthesis, Raymond, you want to run through the evaluation?
Okay. So far, we have had almost 60% of our attendees. So sana po mas marami pa pong umattend. And at least 95% of those who participated indicated na marami po silang natutunan. So it's a reflection po talaga, not just of the topic, but also of the quality of our speakers. So we would like to thank the PGH Department of Ophthalmology and Visual Sciences for this webinar for today, and specifically Dr. Gomez and Dr. Hermar for sharing their knowledge and insights for today's webinar. Dr. Susie?
Thank you so much, Raymond. And, I just wanted to say na, sometimes on the Zoom, konti lang tayo. Pero pag sa playback, libo na. Raymond, which episode was that?
We had that last week during the inborn errors of immunity. Yeah.
Yeah. So, I just want to thank our doctors, no? Kasi, although malaki yung participation natin sa Zoom, when the topic is really good, the word goes around and people go back and listen to it. So thank you so much to our speakers kasi kinakarir nila itong presentation na to. Okay, so for our synthesis, we'd like to thank our speaker also, but we would like to welcome Dr. Dion Sakdalan, who is PGH Coordinator for Training. Dion, take it away.
Good afternoon. Can you hear me well? Doc Susie?
Yes, okay.
Very clear.
Okay, good afternoon po everyone. Thanks again, Doc Susie and Doc Raymond, for again a very interesting discussion of a very prevalent problem that we have nowadays. No? So just to synthesize our discussion, today we hold our 142nd episode. Wow, and dami. We've been doing this for the last 3 years, I think, and we've reached more than 100 already there, up to 150. And our webinar title is Vision, Minsan Malabo, Minsan Malinaw, Dahil kaya sa diabetes. No? And as always, we had a very comprehensive and interesting presentation and discussion of the topic on blurring of vision due to diabetic retinopathy as a complication of diabetes. So thank you to our distinguished panel of UP College of Medicine professors who are also ophthalmologists in the Philippine General Hospital. So our first presenter was Dr. Tin Gomez, Doc Tin. She gave an overview of diabetic retinopathy and how it can be prevented. So she emphasized that diabetes, especially if it's not controlled, can cause a wide range of symptoms and problems in the eyes. So there can be error of refraction, blepharitis, or yung pagmumuta ng mata, or recurrent hordeolum, or yung pagkaroon ng madalas na kuliti, dry eyes, and those are the milder symptoms. In other cases, there can be early development and progression of cataract, and there can already be diabetic retinopathy as evidenced by hemorrhage, may dugo dun sa loob ng mata, glaucoma, or even retinal detachment. And this may actually cause, according to her, permanent damage, panlalabo ng mata, or even blindness, no? And ang culprit dito is, as she has explained to us, is hyperglycemia, kung mataas ang levels ng blood sugar. Meaning, kung may diabetes, hindi na control na maganda ng medications at ng tamang pagkain. She mentioned about the risk factors, and she said 3 specific risk factors: the duration of diabetes, among others, no, comorbidities like hypertension and dyslipidemia, and poor diabetic control. And if you think about it, the last 2 are modifiable, meaning we can do something about it. No? So as mentioned, there are a lot of symptoms, but there are no early symptoms until there's already blurring of vision. So it's important, and this has been emphasized several times, to have the eye checked once one becomes diabetic. Because most of the time, sabi nga ni Doktora, the damage is towards the periphery of the retina, and sometimes hindi obvious yung damage, but there's already progression of the damage. No, so what's the answer to the late diagnosis of this problem? She said, have yourself screened. Don't wait for the blurring of vision to happen. If you have diabetes, within 5 years, right away, actually. Right away, if you are diagnosed with diabetes, go to your ophthalmologist already. Now, if the diagnosis is done or happened in children before the age of 30, or if it's a type 1 diabetes, she mentioned, and even Dr. Greg said, within 5 years of this diagnosis, dapat magpakita na sa tamang doktor. No? For those pregnant, they said within the first trimester, consultation with the ophthalmologist should already be done. So once you consult, the specialist now evaluates your eyes. And yung evaluation ay hindi lang po refraction as we see in most optical centers. No? There is a very comprehensive, kung nakita niyo po yung listahan ni Dr. earlier, it's like a long list of probably 8 to 10 tests, no? And only the ophthalmologist will be able to do that. And from that initial evaluation, they will be able to diagnose what type of problem there is already. And of course, once the diagnosis is clear, they will be able to intervene. And I think one way to prevent this blurring of vision or worsening or even blindness is to be able to intervene early. So how can they intervene? As specialists, they can do laser treatment, they can give injections of medicine inside the eyes, and even eventually, if it's worse already, they can do retinal surgery. So Dr. Tin ended by saying the loss of vision among diabetics is preventable. So importante that we shouldn't be in denial. If you have diabetes, isipin na natin we need to take care not just of our diet but also of our eyes. Consult your ophthalmologists already. There should always be a direction towards a change in diet and change in lifestyle. Have our eyes checked and follow the expert's advice. Again, that denial aspect, no? If the experts say kailangan ng intervention, then you have to follow that advice. If you need second opinion, then go ahead, because it's very important to take care of the eyes, because we don't want to be blind earlier on during our lifetime. And finally, ang very important na sinabing doktora siguro is after the vision has been corrected, you need to control still the blood sugars and all other medical conditions. Also, she said that no eye drops will treat the blurring of vision if you are a diabetic. So very important that you consult your specialist or ophthalmologists right away. Our reactor, on the other hand, Dr. Greg Hermar, or Doc Greg, gave us an overview of the increasing burden of diabetic retinopathy. And he mentioned that this is diabetes in the first place is a global emergency, and that among those with diabetes, diabetic retinopathy has a high prevalence. No, in Southeast Asia, he mentioned it's around 20%, but in the Philippines, it's a bit low, maybe because of the data gathering, but in PGH, the retinopathy is actually very high. So he discussed or listed the different ways that the society and the medical specialists have been doing to increase the awareness and to develop or to promote screening programs to be able to diagnose a diabetic retinopathy. So he mentioned about primary prevention, and that means improving the awareness, not just of patients, but also of healthcare providers. Again, change in lifestyle has been mentioned, and high compliance to medications, not just for diabetes, but also for other medical illnesses. Finally, he stressed the importance of organizing a systematic national screening program to be able to catch these patients earlier on, so that early intervention may also be ensued. So he mentioned about, in terms of screening, he mentioned about harnessing the evolving role of telemedicine and the use of artificial intelligence tools and even portable devices. And I think what's more important is not just having all these tools, but really putting together all the efforts of the specialists, the primary care physicians, the private organizations, and hopefully the government can boost all these efforts from all sectors to have that more comprehensive screening program for diabetic retinopathy. So with this global emergency of diabetes, I think it's really important to organize the efforts of our specialists, our internists, endocrinologists, our government and the private organizations to increase the awareness and improving the screening for eye complications related to diabetes. So when we go back to the title of this webinar, we say vision, minsan malabo, minsan malinaw, dahil ba sa diabetes? I think the bottom line here is for everyone, whether we don't have diabetes or we do, I think an yearly eye check with our proper doctors would be best practice. Ano ba naman yung once a year or once in 2 years magpakita tayo sa ophthalmologist just to have that inside of the eyes check. And if we have diabetes, don't deny anymore. We need to consult the right doctor for a more complete and extensive evaluation, early intervention to delay the worsening of permanent damage or blindness. So that's it. Take it away, Ma'am Doc Susie and Doc Raymond.
Oh, thank you so much, Dion. Galing-galing, Dion, mag-synthesize. I loved it. I really loved it. That was a great summary of everything that was discussed. And for Tin and Greg, thank you so much. If you look in the chat, you'll see the appreciation of our audience.
Yeah.
I think for many, this was an eye-opener. Forget the pun, right? But we just want to thank you so much for your time. And Dion, galing mo mag-summarize. Talagang. Okay, so next week, we have a very interesting topic. And I hope you'll all be around to listen to it. It is about music therapy. And it is about music therapy for children who have autism. Now, I know that even in our family, lumalabas yun yung autism. And we're gonna hear from a specialists who are doctors who are using music therapy to treat autism. So be with us next week when you do this. Sige, Raymond, over to you.
Thank you so much, Dr. Dion. Ay, sagundaan ko yung sinabi ni Dr. Susie. And for our doctors
Galing,
again.
Galing.
Oh, galing. From the PGH
Galing.
Department of Ophthalmology Visual Sciences, maraming salamat po. But before we end formally our program, we'd like to remind everyone that all Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel. You just go to your browser or sa inyong cellphone, youtube.com/TVUPPH, or you just search TVUPPH doon sa inyong search bar and you'll be able to find all 141 episodes. After today, maging 142 na po ito. You can watch them in the playback. If not there, you can also watch them doon po sa ating Facebook pages na meron po tayo. We also understand everyone is very busy. So what we try to do is to call up short videos, short presentations, we lovingly call SCD Shorts. You can watch them at your own convenience. Again, nandun po siya sa TVUP YouTube channel. So this formally closes our webinar for the week. Magkita-kita po tayo ulit next week. We really appreciate everyone who participated and attended dito po sa webinar na ito, even on a holiday. So maraming salamat po. And for those na ating mga kapatid na Muslim, Idul Fitr po sa inyong lahat. So this formally closes our webinar for the week. We look forward again to your company next Friday from 12 noon to 2 p.m. It's a day.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.